Well, let me go across now to the head of the All India Institute of Medical Sciences, Dr. Randeep Guleria, who's at the front line battling the corona outbreak. And also, I'm very happy to have online with us a young patient who's recovered from the coronavirus. So really one of the 100 patients who have recovered. That's, as the Prime Minister said, your stories must go viral, Shambli. So it's wonderful to have you join us. But Dr. Guleria, I'll go over first to you. It's day 6 of the lockdown. We saw Mr. Agarwal there being very cautious so far, but some positive signs. What would you see today, the situation for India?
So I think the situation is stable in the sense that we haven't had a large outbreak being reported for any part of the country, and the effect of the lockdown will take a few days for it to become really apparent. But as of now, this curve that we're looking at isn't showing us a big spike as has been seen in other countries. It's still continuing to be on a flatter trajectory, and that is something which is heartening. But I think it's early days. We need to follow it up for the next few days.
Exactly. Better safe than sorry. I mean, that really underlies, I think, the India model so far, especially with the lockdown. Because the time to really be careful, Dr. Guleria, it would be, I guess, next weekend, which would be when 14 days of the lockdown or when any symptoms will emerge. So that's when you'd have a more real extent of the current situation. Is that right?
Correct. I think we would have to wait for another few days before we are able to really look at the actual effect of the lockdown and how much it has worked in containing any community spread.
And Dr. Guleria, the interesting bit is also the relatively higher rate of recovery of patients that we're seeing. 100 patients recovered. I have one of them with me online right now, Shambli. And Shambli, firstly, it's wonderful to have you join us on Skype and to see you smiling there. So tell us about your story, because it's really inspirational as well. It's a story of positivity at a time when people sometimes get very negative about this coronavirus. So if you get it, tell us your story.
Yeah, the main thing is like you don't have to get panic or worried about any situation, because doctor and their team are doing their best for treating you. So don't get panic or don't think anything negative about this disease.
And how? Tell us a little bit about your experience. You were a medical student in Georgia and you came back, and you, even when you were suspected, you said you would prefer to stay in hospital so not to spread it. So what's your message to everyone who's watching you tonight?
If you are having any kind of sign and symptom, don't hide it from the doctors or from anyone, because it's not a shame or something. So just be proud and be confident that you will get cured. So just don't hide anything from anyone.
Dr. Guleria, the message there from young Shambli, but also, is that something you see as encouraging, the number of patients who have recovered already, 100 patients who've been recovered?
Yes, I think this is very, very important, and I would congratulate your channel for actually doing this. I would actually request that you should have one patient every day on your channel who is recovered, because there is such a lot of fear and panic, and people don't realize that more than 80% of individuals will have a mild illness. They would recover without even realizing that they had COVID-19. 20% may need hospitalization, but only around 5% will need ICU care. And the mortality still is very low. It's 2 to 4% and much higher in the older age group, whom we need to protect, and also protect those with comorbidities. So I think there is a panic when people sort of think that COVID-19 is almost like a death sentence, and therefore it's very important to get that message that there are people who have recovered, gone back to their normal activities, and I think this young girl has shown that how one can really come back. And other message I think is also very important, that don't hide your symptoms. Very often people have that feeling that what will society say if I get labeled as COVID-19, my neighbors will start staring at me, I will be considered in a bad way. That is something we have to get over. We have to stop doing that. We have to understand that these are people who need support, the family needs support, and we don't need to behave in this manner.
In fact, Dr. Guleria, Shambli, I'd like to ask you about that. Did you feel that? I mean, I'm glad you've come out, but many other people, patients have said that we don't hide our identity if you do a phone in with us. We don't want to go public. Why did you decide to go public and to come on tonight?
Ma'am, because in our society, the people are thinking that even I didn't meet anyone from my family member also or from my neighbors also. but they are just behaving like they will got COVID-19 because of me or something. But whenever I get symptom, I just got admitted in the hospital, so I didn't meet anyone. So there is no such a situation to get panicked that yes, they will got COVID-19 because of me.
And
it's totally fine to.
What kept you going, Shambli? Was it the doctors working with you? In fact, the doctors have really been the heroes of all the doctors, nurses. What kept you going? Your parents' prayer? What kept you going?
Everything kept me going. Even the doctor and all the nurses, staff there, they were just keep me motivating that don't worry, you will get cured, everything will be fine. My parents' prayer, my parents' blessing, everything worked on.
That's really lovely to hear, Dr. Guleria, because of course we know that doctors, nurses leading that battle, but there are also issues that we must, I mean, as you said, we can't relax our guard, and one serious issue has been of proper protective equipment, not just in India. We've seen in the United States visuals of nurses wearing crash bags. We've seen doctors in perhaps not in Delhi, but in districts saying we don't have proper equipment. How are we meant to fight this war if you don't arm us properly? Is this something you would want the government to focus on? We have a story which shows that the curfew and lockdown is actually delaying supply of this safety gear to doctors and paramedical personnel who need this.
So I think the most important thing is to protect our healthcare workers, and we have to take all steps to see that they are protected, because they are our frontline warriors, and they would get discouraged if we are not able to provide them with the proper PPEs and the other N95 masks that they need. There are steps being taken to centralize this, and the government is actually working on seeing how they can increase the production and smoothen out the supplies to all parts of the nation. I am also aware that a number of industries have come forward and started looking at indigenous or local production of these personal protection equipment and N95 masks, goggles, because at this time we can't rely on any imports coming from other countries, because everyone is having a shortage. We will have to be innovative, look at things that we can do. We at AIIMS are doing a study. We are trying to see, can some of these personal protection equipment be recycled? Can we sterilize them again and reuse them? That will be something that we could do, and maybe use them again and again if we have an acute shortage. So I think we have to be innovative. These are times when doctors, engineers, industrialists, and I would say people from all walks should come together, put their minds together. We are a very intelligent group of people. I'm sure we can find a local solution.
And what would you say to those who, in a sense, are stigmatizing doctors, health workers? We see all those horrific stories of people saying we don't want doctors and nurses here. In some cases, Air India officials and other people who are dealing with corona patients. So what would you say, Dr. Guleria? And then final thoughts from you, Shambli, on that.
So I think this is very sad, and I would really appeal to everyone that you clap for all of the healthcare workers on Sunday, but this is something that is very, very important for you to understand. These are people who are putting their life at stake and fighting to look after your own near and dear ones. They are themselves scared, they are worried. They are also worried that they may take the infection home and cause their elderly parents to get the infection. Yet they are fighting this battle for you. I would request you all to really look after them and cheer them rather than disheartening them. And there is something we need to do in the public domain in terms of trying to change this perception. If I can, I'll just give you one example which a colleague of mine just told me in the morning, that he said in our colony a WhatsApp message came कि एक COVID पकड़ा गया. No, what does that mean? We are not trying to catch people, they have not done any harm. They are people who have unfortunately got the infection, and we need to treat them as patients and try and help them out.
Absolutely, and the whole point is that once they've recovered, they're not passing it on anymore. So Shambli, final thoughts from you tonight also. What would you like to tell all the viewers about the doctors and nurses and the heroic work they've done, and they should not be stigmatized, and this panic of fear that is being spread?
So the thing is, so many patients are getting panic on doctor or the working staff there. So just don't panic on them and just be calm, because they are giving their best and they are doing their best to get you cured. And don't ask any question to them that any medical staff that have you taken permission from the doctor to give me this medicine or that medicine. Don't question them, because obviously they will consult your doctor and then they will give you medicine or something. So don't shout on them, don't get panic on them, just be calm. That's it.
Absolutely. And Shambhali, I think that's a wonderful example. Lovely to see you calm and smiling. And Dr. Guleria, as always, the best source of medical advice, and always calm and smiling even in the midst of a very busy schedule. Thank you both for joining us tonight.